Institute of Technology and Science. Take your first step toward a future in excellence.
Good morning, everybody. My name is Ramya Kannan, and I am the Tamil Nadu Chief of Bureau for the Hindu. It's that time of the year again, and despite everything that has changed in the past year or two, it remains quite the same for students. It's time for them to figure out what they're planning to do for a career. And while several uncertainties as part of the pandemic remain, it is anyway time for them to figure out what line at least that they will be pursuing in order to strike out later in life. These months are frankly the building blocks in a student's life, particularly so in this country. And it is in this context that the Hindustan Institute of Technology and Science, in association with the Hindu Group, has decided to host a series of webinars focusing on providing expert career guidance to students from classes 10, 11, and 12. And today, we have a webinar on a career in allied health sciences, the current trends and future prospects. Our eminent speakers today include Dr. B. Rajshekhar. Let me give you a small introduction to all our speakers even before we begin, so that they will have an uninterrupted session. Dr. B. Rajshekhar is the founding dean of the first full-fledged College of Allied Health Sciences in India, Manipal College of Health Professions. He is the longest-serving dean of Manipal Academy of Higher Education, which is an institution of eminence. After stepping down as dean, he is currently professor in the Department of Speech and Hearing and advisor for the Allied Health Sciences program of the university. He is an alumnus of ISH Mysore and the recipient of several international fellowships and has led the field in several specialized areas. He has a professorial chair, CAF, and Professor Bello Rajshekhar Chair in Head and Neck Cancer Research and Voice Restoration in his name at the Manipal Academy of Higher Education, a deemed to be university. He has served as the president of the Indian Speech and Hearing Association for 2 consecutive terms. He's associated with the RCI as inspector and member of the committee. He is a member of the academic councils of several universities across the country. And he has over 75 publications in peer-reviewed index journals and 1 book chapter. He has also guided and co-guided over 20 PhD candidates of his specialty and related allied health specialties. We have no doubt that he is indeed the right man to be on this panel today. Our next speaker would be Dr. Jayaprakash Shetty, who has finished his MBBS from the Government Medical College in Mysore, an MD in Pathology from Kasturba Medical College, Manipal Academy of Higher Education. He's an FRCP, Glasgow, United Kingdom, with vast teaching experience in pathology and laboratory science. He has more than 100 publications to his credit in both international and national journals, and he's also the principal investigator for research projects. He has attended many conferences and chaired a lot of CME sessions, and is a postgraduate guide for MD pathology and for PhD postgraduates. He's an examiner for both undergraduates and postgraduates at various universities, including the DNB. He's one of the board of editors for the Journal of Neurosciences in Rural Practice, Journal of Pediatric Oncology, Journal of Evidence-Based Medicine and Healthcare. And he's on the steering committee member of India of UNESCO Chair on Bioethics, Haifa. The recipient of Doctor's Day Award from the Indian Medical Association, Delhi. He has held various positions in several organizations, including the IMA and Rotary Club. He was registrar of K.S. Hegde Medical Academy and is a member of the board of management at Nitya University. Currently, he's working as the associate dean of K.S. Hegde Medical Academy, constituent institution of Nitya deemed to be university, and also the professor in HOD, Department of Pathology, K.S. Hegde Medical Academy. We come to our speaker today, Dr. Professor R. W. Alexander J. Sudarsan. Those in Chennai might be familiar with him as the former principal of an eminent institution, the Madras Christian College, Chennai. He's a dynamic leader, a world-class educationist, professional researcher, able administrator, and most importantly, the Pro Vice Chancellor of the Hindustan Institute of Technology and Science, deemed to be university in Chennai, India. He actually obtained his PhD and DSc in entomology from the University of Madras. His research interest is includes funded projects by national and international agencies. He has guided 10 PhD scholars and published nearly 160 high-quality research papers in journals of high repute and presented research papers in conferences organized both within the country and abroad. If you know him, you know he has won several accolades from distinguished bodies and served on the boards and committees of renowned institutions, including the NAC Peer Team Member Coordinator. Widely traveled around the globe, and he is a constant on newspapers this side of the country. Welcome, everyone. Welcome to this event. Shall I suggest that we start with Dr. Rajshekhar, and we will be followed by Dr. Shetty, and Dr. Alexander will bring up the tail of today's seminar. And we also have a slot for questions for the audience. Please remember to write your questions in the chat box so that we can pick them up, and you can write them down as and when the conference is happening so that we can pick them up later and address it to the speakers. Thank you so much. Dr. Rajshekhar, please.
Okay, am I visible and also my PowerPoint presentation, right?
Yes, sir.
Yeah.
Yes.
Okay, just one sec. Okay, very good morning to everybody, all the participants, and Vanakkam from the West Coast. I'm in the West Coast where you are on the East Coast anyway. And I wish to place on record my gratitude to the Hindustan University Technology University and also the Hindu for the honor given in participating in this webinar, which is going to highlight you about a career in the allied health sciences, which is a new concept in healthcare in the Indian context, at least, the current trends and the future prospects. I wish to offer my respect to the Pro Vice Chancellor, Dr. Alexander, and also my regards to my colleague who is across, right, at Mangalore, that is Dr. Jayaprakash Shetty, and all the members from Hindu who are here to provide us with all the technical help. Okay, so by virtue of being the founding or the former dean of the first full-fledged college of allied health in the country, right, I think I will just give an overview of how this profession evolved, certain nitty-gritties about this, certain things which you as parents and students will be looking forward to. And then you will also hear from Dr. Jayaprakash, right, who will be highlighting about some of the, the allied health programs, right, under his belt. And we also have Dr. Alexander, who would probably kind of sum it up and then give you, and then we're open for any question and answer sections. Okay. So first, if you look at the history and genesis of the allied health professions. Now, if you look at 100 years back or 200 years back, the healthcare delivery was under the gambit of the medical personnel. When you said healthcare, it was either a doctor or a nurse, nobody else. Okay. Then, of course, came the compounders who were trained by the doctors, to do some odd jobs and then, be with them to assist them. And post-war, I'm talking about the World War, right? When the post-war, when a lot of casualties took place, a lot of injuries took place, disabilities took place, you needed somebody who was beyond, providing medicine or, surgical interventions, but then who would take care of the lost functions or, to rehabilitate so that the quality of life of the person will be compromised, will be, enhanced. That's what we call it, the holistic, healthcare. So that's how this concept of allied health professions began. But unfortunately, it's a very basic level because the doctors trained their own assistants, whoever they could catch hold of, and then assist them in maybe, in putting a plaster for a fracture or, in dressing up and all that. Okay. But then now, of course, if you look at the global concept, we are 40, 50 years behind the global concept, right? But currently, all of us understand that the healthcare delivery is no longer just a purview of the doctors and nurses, right? You need a team, you need an interdisciplinary, you also need a multidisciplinary team. And even among the medical faculty, now you understand that, unlike 30, 40 years when you had a family doctor who used to, be a physician, a surgeon, a gynecologist, a dermatologist. Okay, whatever you say, he's a doctor for the whole body, but now you have specialties and you also have super specialties, which means the healthcare is evolving with more specialization, with more avenues for, for catering to the holistic health of the clients we serve, that is the patients. Okay. So with that thing, the doctors and nurses who were, at the helm, right, got to add on. So the team effort became the mantra. And then the healthcare system took a new paradigm shift in terms of drawing upon the expertise of both clinicians. When I say clinicians, I'm talking about a surgeon, a physician, and the non-clinicians who could also be medical people, but who are, in say, microbiology, pathology, virology. So all that, have to come together. And also the other people who were more into the assessment, more into the handling of the equipment, and more into the rehabilitation, or what you call therapy. Okay, so they were called as paramedical staff, but the term paramedical is obsolete now in the Western context now because nobody says the paramedical. The term now has, because they all been raised from a basic level of not being trained or self-trained or with a certificate and a diploma to higher levels of starting from a graduation and then go to the master's or post-graduation and even to the doctorate levels in allied health sciences. So now the term paramedics or techs or technicians or whatever you call them is obsolete in the Western context, but it has to seep into the Indian scenario. And they are in general known as the allied health professionals as a thing. In fact, we've gone one step ahead and we have even changed the name from allied health to health professions. That's the term now which is being now used in Europe as well as in the US. Everybody is the health professional. Okay, but let's stick on with the allied health professional because that is the area of today's interest for us. And the question of what is allied health was asked to me by the People's President, Dr. APJ Abdul Kalam, when we had an exhibition in Pune. When he started the college, he said, "What is allied health science? I don't understand." It took me about 5 minutes to explain to him, but but he was very quick to grasp. And in fact, he gave me some examples of the health system. And when he knew that I could speak Tamil, he in fact belted out some tirukkurals from health sector, saying how the healthcare system should come together for the succor of the patients. So I will let you know what is allied health as we understand now. Now the Public Health Foundation of India, they went on to do a survey, and in fact the task force came to Manipal first, and then I was a task force member, so they went about the country doing surveys, okay, and then finding out the need for it. What is the situation in terms of the curriculum, in terms of the different programs being offered, job opportunities, and all that. They really went on a big, research, and then they have now defined that allied health professions include individuals who are involved with delivery of health or related services. So, as an allied health profession, you will be involved in health or any of its related services with expertise in, it could be therapeutic, it could be diagnostic, that is assessment and evaluation. It could be curative. Maybe you could, even offer, some kind of a treatment, and preventive efforts. Okay, so all those things will be clubbed into the healthcare and related services. So when you talk about allied health professional, he's a person who is involved in delivery of healthcare or related services with having expertise in any one or maybe a blend of all these things. This is a definition given by the Public Health Foundation of India, which had submitted its report to the Minister of Health and Family Welfare, based on which the new council has been launched now. And who are allied health professionals? They work, where do they work? They work in interdisciplinary health teams, which includes the physician, the nurses, the public health officials, and do what? They would promote, they would protect, they would treat and are managed. For example, I say treat, I'm talking about say speech pathology, right? If somebody has a stammering, we treat them for stammering. If somebody has a voice problem, a boy talks like a girl, it's called pipophonia, we treat them to get back the voice. If somebody has a stroke and then loses the speech, called aphasia, we help them to recover the speech part of it. So to promote, protect, treat, or even manage a person's physical, mental, social, emotional, and environmental health and holistic well-being, which means it's a very, very huge, umbrella under which, the allied health professionals will come, depending on the specialty, depending on the team with which they are associated with. But in general, this is what an allied health professional is known to be performing or has his roles cut out in the health sector. Now, so in a nutshell, they would contribute to the evaluation of a case along with the doctor's assessment, right? If you want to assess somebody's hearing, they do an assessment of the hearing. Somebody has a vertigo or a giddiness, they assess the vestibular functions. Okay, somebody has dysphagia, swallowing, they would assess it. If somebody has difficulty in mobility, like they would assess, like the physiotherapist. Okay, so that way they evaluate, they identify, they also come in terms of prevention of disorders, and of course they do rehabilitation and health systems management. When I say health system management, I'm talking to a group of allied health professionals who were earlier known as medical records. Okay, that was a very, very old term. A medical record then meant just an outpatient, inpatient files to be carried. But now it's much, much more than that. Now we have the electronic, medical records, and you got coding and billing and health insurance, which is much, much more than what we all understood. So it's a great scope in that health information management as an allied health professional. So the need for these professionals was realized by the Indian government, and the concept, of course, took off, I think maybe some 20-25 years back with, some kind of a stray, colleges or courses being run out of the medical schools in universities, but with no formalized way of a college or, in toto dedicated to this. Till in the West Coast, we started off the first college. And later on, now we have many universities, including in Chennai, we have universities which have dedicated allied health professional courses and colleges. Okay, so the Western context, if you see, now it's been well recognized and evidenced that allied healthcare professionals play a very crucial role, stellar role, essential role across the value chain of the healthcare services. If you go to the US, you will find that 60% of the healthcare workforce constitutes the allied health professionals. Hence the great demand. And fortunately or unfortunately, 80% of my own alumni are all overseas because of excellent job opportunities, recognition, as well as the dignity or the degree by which they are looked upon by the general population and the healthcare system. If you go to the UK, United Kingdom, you have a government run or government supervised what's called as the National Health Service, right? So more than 84,000 allied health professionals who play key roles within the National Health Service. So that is the regulatory body in the UK. If you want to go to UK, you will have to be accredited by the National Health Service as an institution or a college which offers these programs, and also be licensed by them. Okay, all that. So now all these professionals work autonomously. They work, it means independently. They can be practitioners. They can also be multi-professional teams. It could be in the hospital setup, a polyclinic, or whatever it is. If you go to Australia, you will find besides doctors and nurses, there are 90,000 university trained, okay, which means they are taken up at a higher level, not a level of a certificate or a diploma, but a degree level means it goes above graduation, masters, and then above that, autonomous allied health professionals who are vital to the healthcare. Now, in the Indian context, if you see, well, we boast of, Nalanda, we boast of Bhattacharya, all that Aryabhatta and all the people, who are, they're supposed to be the, the leaders or pioneers in education, if you take up the history. But unfortunately, besides our strong professional and health education systems, in terms of training of the healthcare workers, there's been a skewed pattern. That means traditionally, the focus has been on medicine, dentistry, nursing, and pharmacy. But this sector neglected, not that, it's neglected, maybe lack of awareness and, lack of, evidences to prove that these people also contribute to the healthcare. Okay. So unfortunately, the allied health professionals did not receive its due recognition. Most of them remain at the basic level in terms of qualifications. Very few allied health programs dedicated in the country, as I told you, and very few professionals with an undergraduation. That's a minimum, a degree or a postgraduate degree, and many were relocating overseas because of the job opportunities, the pay package, and so the brain drain brought a real scarcity, a shortage of paucity of the allied health professional workforce, which has really loomed high in the health sector, and which is now recognized, right, with the Ministry of Health and the government pulling up the socks and seeing how they can do good with this paucity, and they are now focusing more on the training and the qualification and accreditation and licensing of allied health professionals. So given the growth, right, of these forces globally and India not falling behind, right, India, there's a dire need was felt to develop these programs, and there was a review and drive transformation in the sector, which was picked up in certain areas of India, especially the southern India, where we have recognized, established, colleges for allied health sciences, but very wanting in the other sectors, the eastern sector, the western sector, the northern sector. Okay, so in the India, as I told you, the concept of allied health was quite new, and it was 1998 that our college, we carved out a new college from the medical school. Okay, because our chancellor, thought that if it has to grow, if it has to develop, it has to be independent. It has to be given the trust and the fillip from a person from this specialty instead of a dean of a medical college whose focus naturally will be on the streamlining of the medical programs. That's how the first college was started in 1998 to train health professionals of caliber. Now we have crossed 20 years now. Now we can say with pride that this profession is come to stay in India. It's one of the most attractive job opportunity oriented career. So we also started courses specially designed to prepare at the undergraduate level, master's level, and also at the PhD levels. And we did find that there were rewarding careers nationally and globally growing in the healthcare industry. Now, the Ministry of Health and Family Welfare and NSSO did a survey, and they found that there was a big gap between the supply and the demand of allied health professionals in the country. This is true even with the doctors, true with the nurses. Okay, but it's a big gap of about 6.5 million allied health professionals are needed in the country if you want to really offer a comprehensive healthcare. So the bane, I would say, bane is a demerit, or the disadvantage of this in the country so far was the absence of a central regulatory authority, or what you call as a council. We have a medical council. Okay, we have a dental council, we got a pharmacy council, we got an Indian nursing council, with ASCTA, which all govern all these programs. But unfortunately, there was no council or regulatory authority for allied health professionals, which resulted in the stemming of many colleges or many mushrooming of many institutions where there was no uniformity of curriculum, training, the infrastructure, the faculty, and most important,
I think there seems to be a freeze from Dr. Rajshekar's end. Dr. Rajshekar, are you able to hear us? No, I think.
Yeah, I think there is a power problem. We'll come back now.
Yes.
The postal problem, power goes off. I think another 1 minute. He should be back.
But not. Yes. Can you hear me?
We are just able to hear you.
So that was so looking at the global benchmarks in allied health in US, UK, Australia, Canada, and also Singapore, where the governments are taking care of these professionals by, as I told you, HCPC in UK, and then which regulates accreditation, offers professional standards, and defined even the course duration of 4 years, with 3 years of coursework and 1 year of compulsory internship in hospitals to be qualified as an allied health professionals, and getting them apprenticeships and compulsory mandated registration in the the professional bodies, so that the number, where they can be posted. Okay. Now the good news for all of you, right, is that now you are in a very safe belt, because the Parliament has approved a National Commission for Allied Health and Healthcare Profession Bill after due diligence and the deliberations in Lok Sabha and Rajya Sabha, and now the bill has been passed. So this means that we're going to have a National Council for Allied Health Professions. And this National Commission for Allied Healthcare Professionals will transform the India's healthcare. This will formalize the workforce now. There will be a regulatory oversight. They're going to introduce quality controls. They will design uniform coursework. They will standardize the nomenclature of different people, calling them by different names. They would define essential qualifications for faculty to be a staff of a college, and regular inspections before recognitions. So this is the advantage of the you participants or the future students will be having when you take up the allied health, which was not there till last year. Okay. Now, Minister of Health has said that the group of allied health professionals is large, and the bill is trying to regulate this field by providing dignity to their roles. And our Minister of Finance, Nirmala Sitharaman, also said that this bill would ensure that separate infrastructure for AHP courses. You will be surprised to hear there are a few colleges running on lodges, running on some kind of a building with no infrastructure, no classrooms, no hospital attachment, but they do also offer programs. Students fall to the bait. They pay a fee, they go there, and then at the end of the course, they really feel inadequate in terms of their qualifications. So now the intake capacity is going to be defined. There'll be a cap on number of students. They will also ensure clinical exposure, and most important, the assessment of competency before you get into the field and start working with the patients. Okay, so why you should choose this? Because why a career? Because the healthcare sector is poised to grow. It's already grown. There's a fundamental shift in delivery, as I told you, because of advances in science and technology, more recognition, and great job opportunities, which already are in vogue in the West internationally. West, you can go overseas, but in Indian context now, there will be more job opportunities coming up at the state levels, district levels. So there will be plenty of jobs for you. And there are approximately 200 recognized allied health professions known. Okay, though there are about 350 to 400, but the ones which are recognized are approximately 200, out of which 7 of the 10 fastest growing occupations as per the US Bureau of Labor Statistics, and 1.6 to 2.5 million vacant positions by 2020, again as per the statistics. A few of these programs will be explained to you in detail by Dr. Jayaprakash also, and you can also we'll open it for you if you want to know more about the other programs, because we can't discuss all the programs. But in general, the allied health professional courses are 7 of the top 10 fastest growing occupations globally. Now, there is international evidence that by empowering the allied health professionals, who are the leaders of change, you can improve the reach of the health services even to the urban, rural, and with many number of allied health professional courses, being added up year after year. Okay, great opportunity for a career awaits you all people. Okay, the improved quality of the medical care of course, is a challenge to the field, and there's a need for competent people and to handle highly sophisticated medical machinery. For example, medical imaging technology, the professionals will be handling all the recent equipment, be it MRI, be it, CT scan, be it, PET scan, whatever it is. They're the ones who will know about the instrument, how to handle it. So that's going to be a big boon for the physicians, right? And a diagnostic which is so dependent now on technology now will be vital, right? The role of the allied health will be vital. Now, to list some of the UG, the graduate and PG programs that are available in the Indian context, I'm saying, you have physiotherapy, you have occupational therapy, speech and hearing, nuclear medicine, medical imaging technology, respiratory therapy, medical lab technology, perfusion technology, renal replacement and dialysis technology, optometry, health information management, radiotherapy, cardiovascular technology, exercise and sports sciences, a new thing just come up in the last 3 years, anesthesia and operation theater technology, emergency medicine, clinical nutrition, and even clinical psychology has come under the gambit of this. There are so many of these programs are there, and you will get a peep into a few of the programs from the other speakers, the other specialists too. Okay, and you will be interested to know what's the duration of the course. A degree or the graduation will have to be 3+1, 3 years of coursework and 1 year of compulsory internship, 6 months in the parent center or the parent college, and 6 months will be outpostings in other hospitals or reputed colleges under supervision. Okay, then the post-graduation will be for 2 years, 4 semesters, followed by which, if somebody is interested in research, they could go into the PhD program or the doctoral level programs. So the career opportunities where you can be placed, where you can find a position, you can work in hospitals, you can work in child rehabilitation centers, you can work in industrial setups. For example, the cochlear implant, which is being given to the children who are hard of hearing. You need people, the audiologists, to go into the cochlear implant industry, hearing aid industry. Okay, then your GE equipment, your medical imaging, schools, special schools. You can be freelancing, you can be practicing, you can be your own physio, you can be an occupational therapist, you can be an audiologist, you can have rehab university, you can work in sports academics. Okay, for example, the personal physios or the personal fitness experts of all the cricket players, including Virat Kohli or Saina or your PV Sindhu, are all from the allied health professionals. You can get jobs in diagnostic labs. So to sum up, allied health professionals form a vital part of the health system delivery. The shortage in demand and the awareness has really kind of catapulted this into the career prospects for the students. The placement which is happening now nationally, internationally, will happen. It's just a matter of time, a matter of another 3 to 5 years before we start opening up lots of avenues at district hospitals, in state hospitals, corporate hospitals. And the job as such is quite challenging and gratifying because you're dealing with somebody's health, somebody's life, somebody's quality of life. So most gratifying. The opportunities could be, you could go into academics and be a faculty teaching. You could get into the clinical area now and be a therapist, or you can be an optometrist, whatever it is, dealing clinically. You can go to the industry and then be a part of the industry, or you can do research and then contribute to the specialty. So with this, I've just given you an overview, and I wish you all a very, very challenging career in allied health professionals. Okay, wish you all the best. Now I'll come back to you again if you have any questions. So I think I've just given you just an overview of how these professionals have evolved from about 200 years back to the current thing. So thank you for your patient hearing.
Thank you, Dr. Rajshekhar. May I now request Dr. Jayaprakash Shetty to take over? Yes, sir. Please go ahead. In the meanwhile, there are also some questions in case the panelists want to answer them as and when. Please feel free to do so. Answer them live. Please feel free to do.
I think questions we can take in the last, I think.
No, this is about answering them live.
Okay.
If you see the Q&A, if you want to, that. Otherwise, we will have it at the end.
Good morning. Good morning to everyone. My esteemed senior learned speakers, Professor Alexander, Pro Vice Chancellor from Hindustan Institute of Technology. My another learned speaker, Professor Rajshekaran, the founder dean of Allied Health Sciences from Manipal University and Manipal Education, Higher Education, and the learned moderator, Madam Ramya Kannan from Hindu, and all the dear participants. We are in the era of 2021, the pandemic. Then the lot of career opportunities are on the way for the students of plus two when they are going for the examination. So there is an every time an ambiguity with the students what next will be after plus two. As Professor Rajshekaran said, gone are those days. The paramedical workers or allied health course who have completed are treated in a little different way when I was a student, or many of you are experienced. But gone are those times now. Now the due weightage is given to their paramedical course as well as their profession, for the simple reason that any hospital to run, you require able, learned, allied health science professional, so that treating physician, maybe an intensivist, maybe an orthopedic surgeon, maybe a general surgeon, or maybe a pathologist or a microbiologist to give the treatment, to sign off a report, you need the allied health professional who are ably managing the scenario. Myself, Dr. Jayaprakash Shetty, already introduced from my moderator. I am from K. Segde Medical Academy, a constituent college of Nitte DMTV University at Mangalore, the state of Karnataka. I'll be mainly touching upon few streams of the allied health science and courses. My learned speaker after me will be touching on the other courses. I'll be mainly touching on four important streams after plus two, which are mainly involved in a hospital setup. The first and foremost is the medical laboratory technology, which is most important sought after field for any hospital to run in a better way. For the simple reason that gone are those days you see a patient and treat him by examining him and taking all his history and asking him to lie down, know the parameters and treat him. Gone are those days, you need to investigate him. So when you need to investigate him, the entire of the blood sample, if you take a human body, it is not only blood sample. There are so many things in the human body, from a blood sample to a fluid to a tissue to an excretion. Now you know you are in the pandemic now. The nasal swabs, the nasopharyngeal swabs are taken, and the days may come, the salivas may be taken. So see, these things are sent to an area where there is a diagnostic setup. So you need a trained, or rather to say a well qualified technologist working in that area. To do that, you have one important course, what is called as medical laboratory technology. That's a graduate course, BSc MLT. The entry level to this course many a time is the plus two science, PCMB. Then they should get into this BSMLT course, or if they have done DMLT, there is what is called as Diploma in Medical Laboratory Technology, which runs by the paramedical board. They can have a lateral entry to this BSMLT, because the state paramedical board, I think few years till now, they take plus 10th standard students also. So those who have completed diploma in medical laboratory technology can get into this BSc MLT. So once you are into BSc MLT of medical laboratory technology, you are exposed to several areas. Like if you take the pathology, there are many substreams: the hematology, cytology, histopathology, blood banking, and the microbiology, serology, even your RT-PCR COVID lab, what you are mentioning. Then the biochemistry, therein involves the immunology. All these areas, as a technologist, is a 3-year course. You will be posted in all these areas, and you will be having 1 year of internship. So with this, you will be a full-fledged technologist working in any hospital. So my sincere suggestion to you is, if you are choosing this course. Earlier, my learned speaker, Professor Rajshekhar, was mentioning there are institutes who run in small buildings, small sheds without any proper hospital attachment. The persons who are choosing this particular course should go to a medical college or a hospital setup. So that is ideal for them. So once they are in a hospital around, they will have a feeling that they are with the patient and how the patient comes to you and what sample you receive, what you will do. So once you finish BSMLT, you can join as a technologist in any of these areas what I have mentioned, as you are well oriented with that, or you can go to MSc MLT. There is another branch where you can do MS MLT. You can not only expose to MS MLT, if you are not choosing MS MLT, you can go to some other courses during that time. That is, am I audible? I think power. Yeah.
You are.
See, when you take MSc course, you can take the anatomy, you can take the biochemistry, you can take microbiology. Some of the people can go to MPH also, Master in Public Health. So all these options are available when you finish your BSMLT course. So this is only my request here is all, because earlier in prior to starting this, I was speaking to my learned colleague, Professor Rajshekhar from Manipal. The thing is, one should have a good spoken English here, either written English and spoken English. My request, all of you, if you are choosing this, if you are taking +2 in any of the colleges, if your English is weak, join to a course where you can learn English and get into this course. It will never drive you away back, even if you go to abroad. And one more thing is, now the laboratories gone out those days. Laboratories has to come under an NABL scope. I hope you know that NABL is a national accredited body which gives you a certificate that you are a quality accredited laboratory. So once you are in an NABL accredited laboratory, nevertheless, you are the person who are doing an extremely good job choosing this course. The next course will be the medical imaging technology. Medical imaging technology is one of the important course. Gone are those days you are called as radiographers. I hope Professor Alexander or Professor Rajshekhar will agree with me. They're all called as just radiographers, and in a lighter vein, some of them used to call them as photographers. Gone are those days. Now a scientific image, a scientific value is given to this imaging technology. It is very important. So the course which is starting with +2 is BSc Medical Imaging Technology. Your role in this area is very important, because earlier even our MD degree was named as radiology. Now it has shifted to radio diagnosis. The whole terminology of MD degree itself is changed. So as a paramedic or as an allied health and professional, if you are doing a medical imaging technology, you have a lot of scope in assisting the radiologist as well as in the diagnosis. So it is a 3-year course. It is a 3-year course with 1-year internship. You are exposed to all modalities of innovative diagnosis, like the CT scan, the MRI. The MRI, which was 0.5 Tesla, now it has moved up to the majority of the medical colleges are having 1.5 Tesla, 3 Tesla, and some of the research institutes have gone up to 10 Tesla units. If you take the CT scan, what was Dwyer slice, 12 slice, 64 slice, now it is 128 slice. So to operate this, no doctor or no medical professional is able to operate this. It is you are the person who are one-to-one lies with the patients and give a proper, we say in medical term, proper cuts to the particular organ. Suppose your spine, the MRI spine or the CT spine has to be taken. Every small minute area of the spine has to be selected and the lesion has to be selected. So as an imaging technologist, you have a lot of role in giving a diagnosis to the patient and assisting the radiologist to give the diagnosis. It's a very good emerging scheme, emerging what you call it course. It is not only limits there. Now there are PET scan has come, radiotherapy units have come. It is all so-called the cancer biology or the oncology treatment fully lies with how exactly your setup is tuned with the medical imaging technologies. So once you finish BSMLT, similarly you have an MSc MIT course, then you will be a full-fledged scholar in this particular scheme. Similarly, what I said is the entry is at the PUC science level, PCMB. The next option will be, if you have done a diploma course, you can have a lateral entry. The next important course is Anesthesia and OT Technology. See, Anesthesia and OT Technology is a very important course because earlier the whatever called as the untrained or unmanned operation theaters, we used to call the FNO, MNO, or an age-old individual who are operating this machine without any qualification are gone on those days. Now, if you check any operation theater, it is fully equipped with many gadgets. There are ventilators, there are pulse oximeters, there are fiber optic tubes, there are fiber optic scopes. So many things are there. So, and an anesthesiologist goes to give an anesthesia, a surgeon who operates, he cannot manage the technicality and the amount of the particular oxygen or the amount of particular anesthetic agent which is induced to a particular patient. It is purely done by the anesthesia and OT technologist. And not only the operation theaters, now there is a new concept, or the concept which is already evolving, what is called as intensive care units. The broad terminology of intensive care units has been further narrowed down. Now, if you take, there is a medical ICU, there is a respiratory ICU, there is a neuro ICU, there is a high dependent ICU, there is a pediatric ICU, there is a neonatal ICU. So the ICU itself is subcategorized. So the people who are working, the doctors who are working, go for a particular fellowship to be working only in intensive care. If you take an MD anesthesiology course, these individuals not only will be doing the work in operation theaters, once they do a fellowship, they will go to ICU care. ICU is I know we are in the COVID pandemic. I'm working in an hospital setup here. There are about 30-35 patients of COVID positive or on ventilators. All this management, believe me, has to be done by the anesthesia OT technologists and the side by nurse. If they're not tuned up, and the healthcare, whatever we say, just now we were discussing the amount of mortality, morbidity, any small amount of a particular drug flow or an oxygen flow. I hope you know what you call a ventilator means. You are supplying an artificial oxygen from a particular machine rather than you are breathing. So these technologies has got a huge role or huge importance, or what we say, they make a strong bond between a clinician who is treating and the patient who is suffering ultimately when he is coming out of the ICU. When any patient goes to ICU, many of the participants will agree, always they pray God in the morning, when I see him back to the room or when I see back to walking, because it's a nightmare for everybody. So these courses have got a tremendous importance in a hospital setup. Again, if they want to do an MSc, it's a 2-year semester program, but majority of the, as far as I know, the anesthesia OT technology overall alumnus of our institution, nobody has done MSc anesthesia and OT technology. All are placed in very good intensive care setup, including overseas. The last important allied health science course I'm covering is, because the rest of the courses my learned colleague Professor Alexander will be going to deal with that. The respiratory therapy. This has got much importance in the recent days, because there is in the medical scenario, there is a specialty has evolved, what is called as pulmonary medicine. What was earlier called as tuberculosis and chest diseases has been renamed as pulmonary medicine, and the course not only ends with the MD pulmonary medicine, it has moved into DM pulmonary medicine. So these areas, they deal with only the chest diseases. Gone are those days you are treating only tuberculosis or only asthma. There are so many diseases evolved now. There are so many tumors are started. We don't know whether it is started appearing now or we started detecting. There are a lot of lesions coming in this chest area. So a lot of non-invasive techniques have evolved. See, earlier, for a simple, in English, I'll tell you, if you have a mass in the chest, the earlier treatment was open the ribs, go inside and get it out. Now the things have changed. Things have changed. You have come with a lot of fiber optic scopes. Fiber optic scopes, get into that lesion and get the material from there. So the person who trained with BSc respiratory therapy will be a great assisting person to the pulmonary physician or a chest and disease expert who's treating a patient. So this has gained a lot of momentum, the BSc respiratory therapy, as well as now what is called as, there is a rehabilitative program. Suppose an individual who underwent cardiothoracic surgery or cardiac surgery, he has to revive his lungs or heart back. He is given a spirometer so that his respiratory rate is regulated. So all these things are done by the technologies who are done with the respiratory therapy. So with this overall view of this 4 or 5 courses, I end my talk. I'll be taking the questions later. I'll be handing over to the next session my another learned speaker, Professor Alexander. Thank you.
Thank you, Dr. Jayaprakash Shetty. Maybe now hand it over to Dr. Alexander.
Good morning, and I hope my presentation is clear and my voice is also clear. Hello?
Yes, sure. Yeah, good.
Yeah. My respected panelists were there who spoke and who took much of my time. Dr. Shetty, Dr. Rajshekhar, and the coordinator, Madam Ramya Kannan. And I mean, I have the same kind of time that is given to them, about 10 plus minutes. Yes, Madam Ramya?
Yes, please.
Okay, thank you. And in fact, I would like to thank the Hindu for having given us this opportunity to collaborate with them in offering a kind of a snapshot to our students, our budding students, I think who are registered in large numbers, and hundreds of them are participating and watching, and they are the nucleus of today's program. The point is very important. This program is positioned in such a way that you are in the verge of taking up a career through an educational program. And what is available with regard to the allied health education is something that is what we would like to provide to you. Much has been said by both my friends, Dr. Rajshekhar and Dr. Shetty, and they've done an exhaustive review of the programs available. And of course, they've taken much, and therefore there is only a sediment available with me. And due to paucity of time, I will not be repeating what they have shared, but then move on to dwell on something which you have not probably heard. Now, I think the crux of the matter is that no longer the doctor and nurses, they can depend on their own diagnosis and their conclusion of the ailment. They have to be dependent upon the reports that are being provided to them by many, many people. It could be from machines, it could be from laboratories, and so on and so forth. And therefore, the determination by the doctor or the nurses on the report is completely rests with the allied health professionals. And therefore, you need to understand that those who are going to be opting for these programs are doing something that is very sacred, that is something very important, and one needs to be really careful. And without your report, without your details to the doctor, they will not be able to take a decision. And therefore, with that backdrop, let me now try to move on. I think nowadays you are quite aware of the two important words called as the new normal education, new normal life that we have resorted to. So I have just titled my talk as a peep into the neo-novel programs that are available under the basket of the allied health education. Now, I do not want to dwell much. I think the youth in India are quite large in number. But unfortunately, as we look at the youth in the country, you find while some of them are really good, they have their own startups, they go on to higher education, but there are still a huge number of people who are clueless as to what they will have to be, taking up as something for their higher education, things like that. So eventually, we end up in a situation where there is not enough employable youth. in the country. And now we find that nearly about 30% of the youth fall under this NEET category. By NEET, we know that it is the national eligibility entrance test, but the another connotation for it is not in education, employment, or training. And we find about 30% of them falling under that category, which is quite depressing to take note of. Now, we also find that about 6.1 million Indian youth have lost their jobs by 2020. And therefore, there is something important, unless and otherwise you are sure, you are very careful, you are not going to take up the right program, probably you will also be one of those who are unable to find a suitable job. But on the other hand, if you're going to be choosing the traditional disciplines, probably you may not have that kind of a mileage, like doing your routine BA programs or your traditional BSc programs, but you need to choose something different which will really have a good mileage. And that is what we have to do. And there are many, many good programs which have been highlighted by my colleagues, which will really give you, the kind of consideration for a good career in your life. Now, actually, we have moved from generic to specific. As you know, even life sciences have moved from there to offering molecular biology, biotechnology, and very specific programs. And on all of these programs, as you look at it, there is a skill component that is involved. There is a skill component that is involved. And if you're able to hone that skill component, I think you'll be able to really rise up to the greatest level. Now, as you find now, I think COVID-19 has actually opened up a great amount of opportunity for the allied health programs. And today, we in some of our universities, like the Hindustan University, we're not just restricted to engineering discipline, but we are a multidisciplinary university where we are having allied health sciences, the liberal arts program, because we can all come together in doing something worthwhile, probably identifying a problem, and all of the different discipline people will come together so that a beautiful solution is arrived at, and eventually the humanity is going to be benefited out of it. Now, as you know, all of these programs most of the programs are laboratory-related work, and this is the real support system, as I really outlined to you a little earlier. A doctor or a specialist or a super specialist cannot decide on his own or her own. He or she would be dependent upon the results or the reports of the allied health workers. Now, today, if you take the Indian scenario, I think some of the states, particularly the state of Tamil Nadu, many government hospitals and many private hospitals have come up in the last few decades. And you find that Tamil Nadu has become the hub of its center. So there are a lot of new programs that are going to be offered either in these hospitals or probably in universities and colleges which have tied up with these hospitals. And there is a very big list. Some of them have been dealt with by the earlier speaker, and I'm going to be focusing on something which is not dealt with. Now, I think the first one which I would like to take, which is already in vogue, is something related to physiotherapy. Now, you know that for the past almost 1.5 years, or nearly 2 years, people have been resorted to what you call the WFH, that is work from home. And that has actually resulted in many, many problems among the youth, probably obesity, body aches, and things like that, because people are working for long hours, right from morning till midnight they're working. And a physiotherapy course, those who have done this particular course would be able to come to the rescue of these people. Now, the next important area which my colleagues have not touched is on the geriatric care management. Now, we find, in India, following the Western style, many of the children are not taking care of their aged parents. Either probably for employment's sake, they go abroad and serve there and leaving their parents in their old houses, or probably putting them in the old age homes. And this is the place where I think the course on the geriatric care management comes in, because a very systematic approach is required to handle the age-old people. And of course, they are now confined to old age homes, or probably there at the respective homes. And a person who is specialized in these programs should be able to attend to the aged people in the best way possible. Now, the next important one that is almost related to the present pandemic is the eye problem. I think since most of the work is confined to seeing the screen either in the laptop or in the mobile phone, I think there is a rise in the eye problem. That is why I think you find many optical shops available, new shops that have come up through time, and it is because of the rise in the eye problem. And of course, the area on speech problem has been beautifully outlined by my colleague Dr. Rajshekhar, and which kind of course to be taken, and these are some of the programs which are going to be much sought after in the days to come, because the problems are increasing, and these are the people who are required. I wanted to help with on physiotherapy course, which is going to be for 4 years and 6 months of training, and that is a course which deals with physical movements emphasized to avoid disabilities. Probably the people are not going to be taking care of their health, and if their movements are not going to be set properly, then probably they will be crippled, and they will be physically challenged, and they will even become a disabled people. The second important course which I have been dealt with detail is the medical laboratory technology course, which is available both at the bachelor's level and the diploma level, which will be for 2 years from now on, while the bachelor's program will be for 3 years. And this is again a program which has been there for a very, very long time, and a very popular program with the efflux of problems in human health. I think this course will always be much sought after. The nutrition and dietetics is again a good program because this is the specialist of this program will be able to give a kind of a diet plan to keep the people fit. Because today we find, because of restricted movement and eating junk food, I think we find India being the leader as far as diabetes is concerned, and a specialist in nutrition and dietetics will be able to give a beautiful diet plan, so that if it is followed, I think the people who are suffering from those diseases will be able to have a perfect kind of an orderly life. Then comes pharmacy. Now, I think, again, there is a big boom in pharmacy shops. You find different types of pharmacy shops coming into our places. And there again, I think this is a much sought after program. And those who have finished the pharmacy programs will be able to prescribe the medicines based on the advice of the doctors, will be able to advise the patients as to which kind of medicine will be the best, and also will be able to find work in the manufacturing industry of the medicines and so on. And next comes the pharmacology course, which is a science which deals with the study of drugs that affect the human body, either beneficial or harmful. So these are some of the programs which are going to be in great demand. The new programs that have emerged, which in Hindustan we are offering in collaboration with the Frontier Lifeline, is the first one, perfusion technology. I think this is a BSc program which is much sought after because of the pandemic situation, because we know that COVID affects the lungs, and then you find the pneumonia coming in, and therefore this area of study, perfusion technology, is the study of physiology and pathology of the lungs, and to what extent it is damaged, and also the allied respiratory organs like the bronchi, bronchioles, and things like that, and also the associated equipment. The next one that is associated with the perfusion technology is the cardiovascular technology. This again, those who have done the undergraduate program will be able to assist physicians in the diagnosis and the treatment of the heart, and also the peripheral vascular conditions. Anesthesia technology, as I think much has been dealt with by Dr. Shetty on the BSc program, on the MSc program. Then comes optometry again. Optometry, as you know, this is something you cannot get rid of, like your toothpaste or your soap, which you have to be dependent upon. Spectacles are something that we are going to be dependent upon after a particular age. And those optometrists who are working in the spectacle shop in these eye care units will be able to give you the right kind of a diagnosis in identifying what kind of lens you have to choose. And much of research is being done in this area again. And this is a vision care science, and there's a lot of opening for the youth. And one could consider taking these courses, by which I think you can even have your own startups in your own place, and also probably work in some of these organizations. Speech and language therapy, actually much has been done by Dr. Rajshekhar. And the next two courses, namely, which will be to begin with at the diploma level for about 2 years, is a general duty assistant course. I mean, these are professionals who would be able to aid the nurses, who would be able to aid the doctors in providing health care. And I've already mentioned about the geriatric care management. It is for the planning and coordinating the care of the elderly, mentally impaired patients, and also to improve the quality of life. These people will be able to improve the quality of life remarkably in the aged people, and they'll be able to live for a little longer period. And these are all the 2-year program. What are the opportunities available? I mean, those who have finished their BSc program or a master's program or even diploma programs, they'll be able to advance their studies. It's not that they're going to be stuck as a technician, but they can always add up through lateral entries some of the programs, and they can go to great levels. They can even do research PhD and be probably a scientist or a specialist in that particular area. There is immediate employment if you're going to be finishing these courses. The demand is very high. It is a highly respectable job, and they are highly respected in the society. And there's a lot of career development and advancement. And again, in this particular area, there is scope for a lot of innovation. And if you're going to have a curious mind, a mind with curiosity, you'll be able to work along with the scientists in coming up with new inventions. And eventually, and at last, you'll be able to have a satisfaction and contentment of having served the humanity in health sciences. And to end, I would quote what I've actually quoted in my article on Options Galore. Emerging areas on the allied health education not only cater to growing needs in the society, but also provide job opportunities to the students. I wish each and every student listening to this program great success. You can contact us either now or probably through our email, and we'll be able to help and guide you, because we are all interested in your career, and we wish you the very best in life. Thank you.
Thank you, Dr. Alexander, and all our panelists have done an excellent job in presenting a very holistic picture of the allied health courses. We have quite a number of questions, over 70, I think, and some of them have already been answered by some of our speakers here. But I'm going to bring up some questions that I see coming up repeatedly, because you might have answered some of them, but do indulge us by answering this for the entire crowd. One question that keeps coming up frequently is NEET required to take up allied health sciences courses? That is one. The corollary to this would be, what is the admission process to get into one of the AHP courses?
I think I will go first. I think NEET is not required for these programs. They can follow the norms of the respective universities or colleges which are offering these programs. And I think many of the universities and colleges have already advertised for these programs, and Hindustan has already advertised for these programs. And you can go to the website and log in, and you can register yourself. And there's no NEET examination required. That is to answer to question number one. The second one, Madam Ramya.
Yeah, what is the admission procedure for?
Yeah, this is actually, the admission procedure is the one as per the norms followed by the universities or colleges based on merit. You will be selected, and of course, in some of these universities and colleges, you've got scholarships available. So if you are a meritorious student, you can also avail of scholarships available, and it will be definitely +2 students. Those who have been successful with a good grade can apply. And of course, the present situation, there's no examination, so it is going to be worked out by your respective schools. And if you've got a decent score, you can apply to these programs. And as I said, these are all courses with a lot of job prospects and immediate employment on completion of the course. Thank you.
Do you want to add anything onto this, Dr. Rajshekar, or should we move to the next question?
I think Dr. Alexander said they're very clear that there is no need of NEET, and different universities have their own policies of admission. Okay, I think purely by merit, and also some of them have entrance exams. And some of the courses are in great demand. Naturally, you may have to have some kind of a filtering. And as Dr. Jayaprakash Shetty also said about knowledge of English, the spoken English is also very important. So the different universities will have their own guidelines, right, for selection. But no NEET, definitely no NEET.
Thank you. So since we spoke about English, there's also a question, in fact, multiple questions on the soft skills that are needed. In addition to communication, to be able to communicate in English, what are the other soft skills that we see that we might require for HP? Maybe we should go with Dr. Alexander, Dr. Shetty, Dr. Rajshekhar, in that order maybe?
Yeah, I can pitch in first. Now, I think in some of the allied health programs, especially those which are having the diploma programs, English is actually taught in both the semesters, basic English, and also basic soft skill programs, which include computers. Because as you know today, without computer literacy, it is very difficult for anyone to move on. And therefore, due emphasis is given to English language so that there is basic communication skills, because as of now in the country, I think communication between the patient and the doctor and the pharmacy, I think it is all in English. So it is essential that English is given due importance, and also the soft skills. They appear as courses in the curriculum of these programs.
Shetty, please.
As I already mentioned, the English is a must for every student who are pursuing, especially the courses what I am mentioning in a larger hospital-based setup, because there is a person next to you who's always giving you dictation or anything on an English. So unless and until you know a good spoken English and a good written English, it is difficult for you to, over the period of time, I think first year is over, and when you go to second and third year, then you feel it little difficult, because this is my practical experience what I am saying, because you started speaking with your local language. We respect everybody's language, there's no problem on that. But when it comes to treatment, when it comes to the reference, when it comes to the learning process, it is mainly based on the English. I request all of it is not a difficult task. That I see many questions over there, how to learn English, and somebody has posted me some other way of asking that question. But nevertheless, don't be get afraid of English, because I see we are from coastal background. Professor Rajshekhar sir may witness for that. There are a lot of rural pockets are there. This is just in a lighter vein for a 1 minute. There are students, or there are particular sort of people, they are afraid of coming near close to a person who's speaking English. That is the scenario in some of the smaller pockets of the villages. So those who are registering here, because COVID pandemic, net has provided every student there, don't be afraid. You come front, learn English, and these are all the fantastic courses. And as Professor Alexander said, soft skills is a must. The computer, entering of the computer. See, I'll just give you a simple example. We write urine sample, the pus cells is 122, 1 TO, then 2. And somebody types 122, 122. See, you see the catastrophe there. See, somebody is telling from there, pus cells 1 to 2. So it is 1 TO2, and somebody is writing, typing in the computer 122, 122. So these are all the things, unless and until you know the soft skills, especially the computer data entry and all those things, these courses will make you a very good livelihood, and you will be a strong bond between a patient when he is treated and a clinician who's already made the patient in a better once he is sick.
So, while endorsing the views of Dr. Alexander as well as Dr. Shetty on the need for English, because the medium of instruction is going to be English. So if you want to understand the nuances of your specialty, what your teachers are going to tell you, you must have a working knowledge of English. But I would place more strength on the soft skills, because you're going to handle the patients. You're going to you're going to be working with a human being. So soft skills, your bedside manners. So most of the colleges, as rightly pointed out, they do have a foundation program where the working knowledge of the language. And in fact, see, if you happen to be in Tamil Nadu, if you're going to be in a corporate hospital, maybe you require in a very high flow English. But if you're going to be in Panjalakurchi, or if you're going to be in some place like Muvatupura, or and Wayanad, or some places, you also have to be very conversant with the local language also. So the most important would be the soft skills of how do you talk to the patients, the caregivers, and how do you pass on the information to them. And of course, computer skills, I think is something which cannot be done away with. And I think the present generation is called the I generation. Now, all of you know how to use smartphones, how to use the computers. As rightly said by Dr. Shetty, most of the reports are all now, kind of, computerized. Everything you'll have to retrieve and find it out. So you should have the basic computer skills. And English is necessary because you want to understand what's being taught to you, you must have English. You should be able to communicate fairly well with your faculty, your peer group, as well as people, who understand English. But you should also have a grounding in your own local language too, if you want to cut ice with the patients.
Thank you. Thank you, panelists, for that clarification. We will have the session up until 12:20, perhaps. A lot of other questions are coming in, and one that is coming in different forms is that after finishing a master's, can I still go in for an AHP course? Dr. Alexander, you want to?
Yeah, well, why not? Why not? I think there's no bar in taking up, any program. And yes, you can switch gear. I think the new education policy of 2020 gives room for that. You don't have to get stuck, in your any discipline. If you are interested, probably due to some compulsion, you have taken a postgraduate degree in any program, but then you have a flair for allied health education, you can always switch to, but then you need to satisfy the basic eligibility and then move on so that you are able to do something out of passion. So I think there's no bar in it. Even after PG, you can move to allied health programs if you have the interest and the eligibility.
I wholeheartedly endorse Dr. Alexander. There is anybody who wants to pursue any career, any stream that you want to do, it's a passion that matters. So there is no binding that you have a master's in something that you can't go into allied health profession. But you must make sure whether whatever you're done at the basic level of your +2 will determine, because most of these programs require biology, science, physics, and mathematics, and barring some programs where arts and commerce can also go in. Right? I think only that will decide. Otherwise, I think there is no stopping you from the PG, venturing into the allied health profession.
Thank you, Doctor, for that. Another question, strangely enough, is on the scope for forensic sciences and for nutrition and dietetics. So, is there good scope for these courses?
Yes, I think forensic science is again a very unique field, but I don't think it will come under the allied health sciences program. Of course, it is in great demand. Not many people know about it. It is akin to, it goes well with the study of criminology, and I hope you know there is an exclusive department for that. And therefore, I think forensic science do have its own charm and its own presence in the field of investigation.
Nutrition,
nutrition and dietetics is a very important program. As I said today, obesity has become a major problem, particularly with people stuck to their homes and probably ordering for junk foods. I think you know that Swiggy and Zomato, they are having very big business. There is an upswing. But unfortunately, as I've been discussing, chatting with my own children or with my friends, I think some of them get used to sitting at home, sitting in the chair, working and sleeping, and hardly, I think, they are putting their body to kind of an exercise, which people like us do never ignore. Because I think in Tamil there is a very good saying, "Suvarai vaithe sitharam ezhudha mudiyum." So I think if your body is fit only, you will be able to take up any kind of a work. So the course on nutrition and dietetics, I think those who are specialized would be able to give a good regime of what you need to take at what time, and if you're able to follow the kind of guidelines provided by those specialists, I'm sure I think you'll be able to control, your obesity, and also not just obesity, but also the diseases and ailments that are there. I think through food and the intake, the timing, with exercise, you'll be able to have a fit body, and that is the job. I think the opportunities for them has actually increased in several hospitals. If you go to any diabetes diabetes specialty hospital, you will have these people, the nutrition and dietetics finished individuals being there to give you the charter as to what. So likewise, I think it is there in every hospital, and the opportunities for them are amazing. And I wish that many students take up those novel programs.
Right.
Yeah.
So there's
Add to that what Professor Alexander has said. The treatment modality for diabetes and endocrines have totally taken a new shape. There is a specialty called as endocrinology. So they deal with this diabetes, hormone disorders, and of late we are developing what is called as subclinical thyroiditis. Nobody will be knowing there is a problem in the thyroid, but he develops certain symptoms. So these, wherever these hospital-based consultation is there, there is next to them, he is the expert on who has done on this dietary course, so that it mainly depends on the lifestyle modifications, what you are eating, how much you exercise, what is the hormone balance, when to go for the hormonal assay, what is the variations you expect, and all those things. I think this course has got a lot of importance, especially when the patient is treated and next he goes to a counseling session, what next to be done. So they have a lot of scope, added what Professor Alexander said.
Thank you, Doctor, for that. One again repetitive question is the cost. What is a ballpark figure to do an allied health course, an undergraduate course, in your opinion? I think we can stick to general. We don't have to be specific, but a ballpark figure.
Okay, I mean, I think the fee structure also varies with some of the programs, okay, which is in great demand. Some of them, it's a question of demand and supply also is there. But generally, I think a UG program of 4 years, I think, undergrad program, I think most of the universities and colleges would levy a fee of about, say, 1 lakh per year, right? From 60,000 to maybe to 1 lakh per year. The fee is for about 3 years. And when they start doing their internship, they don't pay a fee. In fact, they get paid because it's a paid internship. Okay, that means they get a stipend when they start working in the hospital. So 3 years. And whereas for a PG program, it could be double the amount, right? And this is besides you are, supposing you take up admission in a place where you need to stay in a hostel, your board and lodging will also cover it. The tuition fee would be ranging anywhere from 60,000 to 1 lakh or a little more than that per annum.
Right, thank you. Is taking biology during your higher secondary a must to pursue any allied health course?
Most of it, yes. Most of them, yes. But you see, if you're taking up a health information, you don't need a biology, right? And even I think for audiology and speech, you can have a combination of physics, chemistry, and mathematics. But having biology, it gives you that basic feel of the, because you're going to deal with the human body, right? So if you have biology, that will be an add-on or it will be value addition. Because up to 10th at least, they have biology, right? So different courses have the requirements. I think probably they can, just go to the website and see, because now with the National Council come up now, they will clearly specify which programs you have to have the qualifications.
Right. I think we have, come to 12:20. We're just there. And we've had a very, very enriching session with all our panelists today, Dr. Rajshekhar, Dr. Shetty, and Dr. Alexander. Thank you very much. There have been multiple questions. We have tried to answer, theme-wise, we've tried to answer. You may get in touch with our panelists later, perhaps, for further queries. Some of them have also left their contact IDs with you. Thank you so much, all of you, for being here with us. And on behalf of the Hindustan Institute and the Hindu, we wish the students who are here a great career and success in life. Thank you so much.
Thank you.
Thank you.
Thanks to Hindustan Times and Hindu. And, it's a pleasure interacting along with Dr. Johnson, Dr. Alexander, as well as my coastal colleague, Dr. Jayaprakash.
Thank you. In fact, I've been able to learn many more things from Dr. Jay Prakash and Dr. Ashekar. And thank you, Madam Ramya, for the facilitation. Thank you.
Thank you so much, sir.
Thank you.
Good night. Bye.
Thanks the Hindu
Thank
team,
you.
Hindu team led by Ramya and
Professor Rashekhan sir, Professor Alexander.
Thank you.
Yeah, all the best.
Thank you.
Vanakkam, Varga, Valarga.
Namaskar.